terms of the economy in the U.S., which has had both a high level of health spending per capita and relatively high rate of real growth in that spending, the share of GDP devoted to healthcare grew from 8.8% GDP in 1980 to 15.2% GDP in 2003. This almost 7 percentage increase in the health share of GDP is larger than increases seen in other high-income countries. Increasing demand will lead to a necessary increase on government spending on healthcare. This will create an advantage for low-cost leaders in the industry who are competing for Medicare reimbursements. And as a result, healthcare costs will take up a larger portion of discretionary income for individuals in the U.S.
The government usually has a pretty significant role in healthcare, but not recently. Many Americans are not covered by healthcare, even though there are many who need it. With the up-and-coming presidential rapidly approaching, the healthcare situation should be changing soon. There are 3 presidential candidates that all focus on healthcare. Democratic candidate Senator Hillary Clinton and Senator Barack Obama, and Republican candidate Senator John McCain. Senator Clinton has proposed a universal health care system. This would provide all Americans coverage by a standard health care program which they could improve if they wanted to purchase extra benefits. Senator Obama does not agree with Clinton, but he does want to make health care mandatory because he does not want to make health care mandatory. Obama would like to significantly lower the prices of health care so it is easily affordable by all Americans. He would also like to accelerate the advancement of biomedical research to better early detection, prevention, and treatment of serious diseases. Senator McCain has not planned on changing the healthcare industry too much, but still has committed to lowering prices. Since the days of doctors making house calls, home health care has been around. Needless to say that the home health care industry has been around for a number of years. The industry has continued to develop because of new technologies that have arisen. The internet has provided a more efficient communication channel between patients and physicians. Additionally, digital technology has provided medical inventions such as glucose readers, digital thermometers, and stethoscopes. Other products that have been developed are motion sensors and video conferencing tools. On the other hand, a problem that the home health industry faces and could potentially slow growth is the shortage of nurses. With the baby boomers retiring and starting to need more medical attention, more nurses will be needed, which the economy has predicted will be a problem.
The next item that we looked at were Porter's 5 forces. The first force that we looked at was the risk of entry by potential competitors. We see this as being relatively high, at least at the local level. This is due to the startup costs being relatively low, which makes it easier for companies and individuals to gain the access to the tools that they need for their businesses. The next 5 forces that we looked at was the intensity of rivalry. This is also very high because all of the competitors are looking to provide similar services. This makes variability very difficult, and the only way to set the competition apart is by brand name and by cost. Cost, however, is difficult to compete with because if the companies drop their prices too low, they will not make a profit. If the businesses are not making a profit, they will cease to exist. The bargaining power of suppliers is quite high. This is due to the fact that the suppliers know that companies cannot operate without their products. With the supplies being a necessity to operate a successful business, companies must purchase the products that they need without complaining, or they might ruin their relationships with what could be their only suppliers. The bargaining power of the buyer is also rather low. It is low because, again, the companies need the supplies to operate the company. The companies do have some bargaining power because if they do not buy the supplies, the supplier will go out of business. This allows both the suppliers and the buyers to settle on a cost that both can operate with. Finally, the threat of new substitutes is rather high. This goes back to the ease of entry into the industry and the low cost of capital. It is easy for a company to start up and offers the same services that other companies in the industry offer. With the cost of supplies so low, it is very simple to gain the items necessary to run a successful home health care business.
Now we're going to look at the strengths, weaknesses, opportunities, and threats of home health care. The strengths of home healthcare are continual innovation, continuing research and development, and personalized contact with customers. The personalized contact is the most important because this gives the company a competitive advantage over the competition by appealing to the emotional aspect of the people. The weaknesses of home healthcare are the cost of home healthcare, dissemination of patient information, and the shortage of the nursing staff. The cost today is expensive, however, the population cannot go without a plan. Patient information deals with the government-regulated issues and requires the utmost caution. The external environment are opportunities, which are expanding into a new market, government regulations, technology, and the aging demographics. Home health care has the opportunity to increase the overall profits and develop a reputable image. The government regulations allow for all competitors to operate on the same field. Home health care has to develop the most convenient means of health care to the consumers for a minimal price. The demographics, age 65 and older, are the majority that they need to reach these services to. The threats are the government regulations, economic conditions, low barriers to entry, and the cost of health insurance premiums. The government heavily regulates the home healthcare industry, which leads into the ethical issues. The economy is currently in a recession, but this does not impact the population very much. The functional strategies of home healthcare are aimed at improving the company's operations by the ability to attain superior efficiency, quality, innovation, and customer responsiveness. The ability for home healthcare is to provide large volumes to achieve a greater division of labor and specialization. To attain superior efficiency with the products sold, home healthcare must adapt to the changing technology for the times of the century. To attain superior quality, home healthcare needs to focus on is by building the commitment and quality to the customers. To attain superior innovation, home healthcare needs to help with the research and development department to determine whether to adapt quickly to the new telehome care, which is using telephone and internet-based communication, which will allow medical professionals to speak directly with patients who live at home. To attain superior responsiveness to the customers, home healthcare should focus on the leadership, employee attitudes and attributes, and bringing new target markets into the company. The business level strategies are the different positioning that are associated with cost leadership, differentiation, and focus. Home healthcare is concerned with cost leadership, being that the competition of the market sets the price for goods and services to be produced at lower units. The differentiation strategy creates a product that customers regard as distinct and innovative. The advantage of developing this strategy demonstrates a strong brand loyalty to the customer. Home healthcare has to be careful not to under the price of the products for fear of losing money and losing quality perception of the public.
Based upon our research and analysis of the home healthcare industry, we've come up with the following trends and recommendations for firms operating in the home healthcare industry. Based upon the strengths and opportunities in the industry, we see that an aging demographic will account for a larger customer base, which means more business. Firms can differentiate by providing more personalized services to new available markets. Niche marketing can be maintained, which ties in with the personalized services. Also, this could be attributed to firms like Lincare Holdings, where they operate in smaller markets like Kearney. Weaknesses and opportunities would include efficient and secure exchange of medical information. Technology could be utilized to secure patient information and to reduce operating costs in the healthcare industry. As the demand increases and government spending is tightly regulated, there's a slimming in the profit margins available for firms operating in the home healthcare industry. So technology is one way in which firms can gain a competitive advantage there. Strengths and threats include continuing innovation from research and development that will lead to decreasing the cost further in health insurance premiums over time. Flexible cost structures can be utilized to meet changing government regulations and other macro-environmental factors. Based upon the weaknesses and threats, advantages, firms could take an advantage of cost strategy. And we previously discussed the slimming profit margins from government regulations.
And this concludes our report from home healthcare. Thanks.